Hello, my name is Samantha Morales, and I work for the Aging and Long-Term Services Department with the state of New Mexico. I will be facilitating the presentation. In this presentation, we will be reviewing Medicare basics, the options that people face when they are new to the Medicare program, and I will provide you with an overview of fall open enrollment, also known as Medicare open enrollment. And lastly, I will be discussing the pre-counseling volunteer role. So in this slide, we provide you with an overview of the New Mexico State Health Insurance Assistance Program, also known as SHIP. The SHIP program is very important as we provide assistance to New Mexico seniors and people living with a disability who are enrolled in the Medicare program. As listed in this slide, the SHIP program receives federal funding to provide free counseling, education through community outreach, and accurate, free, and unbiased information about the Medicare program. So we serve also Medicare and Medicaid beneficiaries, also known as dually eligible people. We also often work with caregivers who are representing their family members who may have Medicare. So during the fall, the SHIP program becomes a very important resource for many New Mexicans who need assistance to review and evaluate their current Medicare coverage. The New Mexico Senior Medicare Patrol Program is a very close partner to the SHIP program and also receives federal funding to provide free services to all New Mexicans who are enrolled in the Medicare program. The SMP program strives to inform the community, inform seniors and their families about how to prevent, detect, and report healthcare fraud. Again, we serve the Medicare and Medicaid beneficiaries, also known as dually eligible people who are enrolled in Medicare and or Medicare and Medicaid. We also work with caregivers, of course, and we provide counseling and advocacy services when people are dealing with some type of healthcare fraud related situation or a billing issue through the Medicare program that they need assistance navigating. So in this slide, I would like to provide you with some historical context about the Medicare program. As you may know, on July 30th, 1965, President Lyndon B. Johnson signed into law the Social Security Act amendments, popularly known as the Medicare Bill. It established Medicare, a health insurance program for older adults, and Medicaid, a health insurance program for limited income people. As we celebrate the 55 years since Medicare was first created, it is important to remember a few things that are listed on this slide. So first, it's important to remember that the Medicare program also serves people who are living with a disability and who are eligible to enroll in Medicare due to their Social Security disability insurance status. So we see, for example, people diagnosed with end-stage renal disease, also known as ESRD, also may qualify for Medicare if they have a work history, which we will get into in subsequent slides. In addition, other folks, including people diagnosed with ALS or Lou Gehrig's disease, may also qualify for the Medicare program, even if they're under the age of 65. And again, that's dependent on their work history. So the Medicare program was not designed to pay 100% of all medical bills. So there is a cost-sharing responsibility for all people enrolled in the Medicare program, where typically Medicare pays 80% on an approved claim, and the remaining 20% is the responsibility of the Medicare beneficiary. So the last point on this slide is important to note. In 2019, according to the Medicare Trustees Report, Medicare covered over 61.2 million people. The breakdown is as follows: 52.6 million people aged 65 and older, and 8.7 million people living with a disability. So the program is robust and it continues to grow. Okay, so in this slide, I would like to provide an overview of how people age into Medicare, how people become eligible when they turn 65. So people after turning 65, a person qualifies for Medicare if they meet the criteria listed on this slide. The first point, people who are collecting or eligible to collect Social Security benefits or railroad retirement benefits are eligible to enroll in Medicare. If the person is not eligible for Social Security benefits, the person may qualify for Medicare when they turn 65 if they meet the criteria listed below the slide on this slide. So the person is either a US citizen or is a permanent resident having lived in the US for 5 years in a row before applying for Medicare. That is an important point. For the population 65 and over that we're talking about in this slide, the takeaway here is that they do not necessarily need a work history. They just have to meet the criteria for eligibility for the Medicare program, and that is listed in the slide, the points we just covered. So folks who are not eligible, for example, to collect Social Security benefits, again, may still qualify for the Medicare program and may still need to enroll. So it's important for people to go to Social Security Administration to find out if they are eligible, if they meet the criteria here. In addition to people over the age of 65, some folks under the age of 65 qualify for the Medicare program, as we discussed earlier, if they meet the criteria listed in this slide. So walking through the points on this slide, the key thing to remember when discussing Medicare eligibility for people under the age of 65 is in order to qualify for Medicare, they do need a work history, or they will need to qualify to use a parent's work history, or if eligible, a spouse's work history. So people without access to a work history will not be eligible for Medicare if they are under the age of 65. So going through this slide through each bullet point. So people who are under the age of 65 may qualify for Medicare if they meet the criteria listed here. So if they, for example, receive Social Security disability insurance or railroad disability annuity checks for a total of at least 24 months, on the 25th month of receiving those benefits, the person is automatically enrolled in Medicare Part A and Part B. So they really don't have to do anything. They will automatically receive their card in the mail, their packet in the mail, explaining their new Medicare coverage. It is important to note that people who are diagnosed with ALS or Lou Gehrig's disease, for example, still require a work history paying into Social Security, for example. However, because these folks are high needs and need medical insurance right away, Social Security Administration waives the waiting period, the 2-year waiting period. So for these folks who are diagnosed with ALS, once they start receiving the first Social Security disability insurance check, they will automatically begin, their Medicare automatically begins on that month. Now, the last bullet point here is important to discuss. So the population, people who are under the age of 65 who are diagnosed with end-stage renal disease or ESRD, for example, also known as kidney failure. These folks, in order to qualify to be eligible to enroll in the Medicare program, they also need someone's work history to qualify. That can be their own work history, or if they don't have enough work history because they're a very young person, they may be able to use a family member's, such as a parent or a spouse's work history. in order to qualify and to become eligible for Medicare and enroll. Okay, so in this slide, we provide a representation of the current Medicare red, white, and blue card that many Medicare beneficiaries, or that everyone who enrolls in the Medicare program, I should say, receives upon their enrollment. So it is important to note a few things about the card. So it includes, for example, if the person has enrolled in both parts of Medicare that I will be reviewing in subsequent slides, Part A and Part B, then Part A and B will be on the card, along with the effective dates of when Part A and or Part B started. What is also important to note is also the number is no longer the Social Security number of the Medicare beneficiary. So Social Security Administration and Medicare change the numbers for many people who had their Social Security number as their Medicare number. And the reason why this initiative took place, and this happened over the course of 2019, and it was an initiative to help prevent fraud, essentially, and to expose people given that their Medicare number was on the Medicare card. So now in 2019, people began to receive in different phases a new Medicare card with a different number with random letters as well. And so now, as of January 1 of 2020, all Medicare beneficiaries now have to use, the doctors have to send claims to this new Medicare number with randomized letters and numbers. So it is no longer the Social Security number. And that is important because through the Senior Medicare Patrol Program, the SMP program, we educate consumers, Medicare beneficiaries, their caregivers, their family members, that it is important to protect the Medicare number because of healthcare fraud issues. So one way to do that is we teach people to keep their Medicare number safe, not to share their Medicare number, and not to give their Medicare number out to telemarketers who may do cold calling. And so this is an important piece of the work that we do via the Aging and Disability Resource Center, where the SHIP and the SMP program are housed. And so it's part of the education that we do when we do community outreach. And so we try to remind all Medicare beneficiaries that we provide counseling to how important it is for them to protect their Medicare number, because it has dire consequences if their Medicare number is compromised. They may receive denials of coverage, for example. They may receive bills if someone is sending claims to their Medicare record, and they're fraudulent claims, they're not medically necessary. So it's not only costly for the Medicare program, but it can really affect and hurt the Medicare beneficiary, because if they have, for example, durable medical equipment that is being charged on their Medicare insurance card, for example, on their record, they may not be able to get a durable medical equipment item that they need in the future because they have, these pending items that are medically unnecessary on their record. And so we always really try to advise that people should be protecting their Medicare cards, keeping them safe at home, and also protecting them just like they would any other financial information that they have. Any bank cards, for example, they wouldn't share that information with anyone who calls them or who visits them. So it is important to remind seniors of to protect their healthcare information just as they would their financial information. Okay, so in this slide, we present a picture representation of the different parts of Medicare. So the original Medicare program is composed of Part A, which is hospitalization, and Part B, which is outpatient coverage. Part C, or Medicare Advantage plan coverage, is not a separate benefit. Medicare Advantage plans represent the alternative way that Medicare beneficiaries can choose to receive their benefits. MA plans, as they are also known, are private health insurance plans that contract with the federal government to provide people with their benefits, their Medicare benefits. Part D, or outpatient prescription drug coverage, is also administered through private plans that provide this type of coverage. We will discuss more about these different types of Medicare options in the next slide. Okay, so when people are new to the Medicare program, what are their options? So in this slide, we provide a graphic showing the two ways that people can choose to receive their Medicare coverage. It is important to remember that one type of coverage is not better than the other. Instead, the right type of coverage for you may be different than your neighbors because it is based on your healthcare needs, your budget, and your lifestyle. So when we provide counseling to a Medicare beneficiary, that's how we begin, essentially. And this is going to be the responsibility of the SHIP counselor during the Medicare open enrollment period, which is coming up October 15th through December 7th. So for the pre-counselor volunteer role, which I will be providing more information on in later slides, the pre-counselor will be responsible for collecting important information that the SHIP counselor will need in order to provide a better counseling around options, which options are better depending on the person's needs. And so here, I just wanted to provide an overview of some of these options that a person new to the Medicare program faces when they first transition. So on the left side, where we have the original Medicare program, we see that the original Medicare program, again, is composed of Part A and Part B. So again, Part A is the part of the Medicare coverage that will cover inpatient hospital stays. Part B will cover outpatient stays, and that includes doctor services, emergency room care, durable medical equipment, as I've already mentioned, and it also includes things like physical therapy, preventive care services, etc. Part D is outpatient care. Now, Part D is not part of the original program. What that means is that if you have a Medicare beneficiary who is taking prescription medications, even though the person has their red, white, and blue card and it may say Part A and Part B on it, that person will need to take action steps in order to enroll in a prescription drug plan, in order for them to have drug coverage insurance, essentially, through Medicare. And so Part D is an important option for people who are taking medications. Now, the last piece there on the left side, on the original Medicare side, is the Medigap option. Medigaps are essentially a secondary health insurance that work with original Medicare. Essentially, Medigaps supplement the 20% left over after original Medicare pays its portion. Not everyone can afford Medigaps. Medigaps can be very expensive. They can range anywhere from $100 a month to over $300 a month, depending on the type of Medigap coverage that a Medicare beneficiary purchases. So what is important, however, is that Medicare beneficiaries have the option, if they choose, to stick with the original Medicare program and decide to get their drug coverage through a Part D prescription drug plan, and they may decide to purchase a Medigap if they have the means and the budget for it, or they may already have a secondary that provides them with comprehensive coverage, such as a retiree insurance through a former employer. Other folks may not need a Part D as in David drug plan, for example, because they may receive drug benefits through, for example, the VA. So there's different ways that Medicare beneficiaries can decide in terms of how they want to receive their Medicare benefits. Now, on the right side, the Medicare Advantage plan side, it pretty much represents the alternative way that people can choose to receive their Medicare benefits. And it's primarily through a managed care organization. So, and we know in the commercial insurance world, for example, There's many of them, different types. So very similar to the commercial insurance world with Medicare Advantage plans, there are many different types of products that are offered to Medicare beneficiaries. These include, for example, HMOs or PPOs. At the end of the day, these types of products are very similar in that they provide Medicare beneficiaries with one managed care product that includes all of the different parts of Medicare. Most Medicare Advantage plans include Part D as well. So they have to include, they're mandated to include the basic benefits of the of the original Medicare program. And that includes hospitalization, so Part A, and that includes outpatient care, so Part B. But they can, if they choose to, Medicare Advantage plans can choose to also include the Part D as in David prescription drug component. In general, most Medicare Advantage plans that we see include all of these different pieces. Most of these plans do provide prescription drug coverage. Many times, these plans can also provide additional benefits. You may have heard of some Medicare Advantage plans who do provide Medicare beneficiaries with dental coverage, even if it's basic dental coverage, for example. Sometimes they offer some type of hearing coverage, routine hearing or routine vision care. These are pieces that are not necessarily provided through the original Medicare program. But Medicare Advantage plans can offer extra benefits, but keep in mind, we always remind Medicare beneficiaries, especially during the fall open enrollment period or the Medicare open enrollment period on October 15th through December 7th, when they're shopping around looking for different types of coverage that better suits them, that some Medicare Advantage plans can charge extra for these extra benefits that they offer the consumer. Okay, so I've already provided, I've already spoken about the Medicare open enrollment period. So in this slide, we would like to provide you with 5 takeaway points about the Medicare open enrollment period. So the points intended in this slide are very important for consumers to know. So the first thing is just reminding consumers of when the Medicare open enrollment period is. And it's really through October, it starts October 15th and runs through December 7th of every year. It's also important to note that Medicare open enrollment is the term that Medicare uses to describe this period, but sometimes Medicare beneficiaries that we speak to may refer to the Medicare open enrollment period in many different ways. Some people may call it Part D. Some people may call it, just the time of the year when I can make changes to my coverage. So Medicare open enrollment period is the official name, but often people have many different colloquial ways of referring to this moment during the year when they can make changes to their existing coverage. So the second bullet point here, the second check here is important to note. So people enrolled in Medicare can make changes to their existing coverage in the following ways. So during this time of the year, people can join a new type of Medicare Advantage plan, or they can join a different type of Medicare Part D prescription drug coverage, a standalone prescription drug plan, which means it only offers prescription drug coverage, or they can switch between original Medicare with or without a Part D plan, or they can go into a Medicare Advantage plan. So there's an array of different combinations that people can, the different choices that people have during this time of the year is important to note. And so they can make different choices. So what is important, however, is to note that any changes made during open enrollment will take effect on January 1st of the following year. So in most cases, open enrollment is the only time people can actually pick a new type of coverage, whether it's a Medicare Advantage plan or a Part D prescription drug plan. They may not be able to have this opportunity in the new year. So it is important for people to not get stuck in a plan that doesn't work for them. So these plans do change from year to year. And so this is why the SHIP program tries to do as much community outreach as possible so that folks are informed that this is the time of the year when they really need to evaluate their health insurance coverage through Medicare to decide whether or not it will work for them in the coming year. Because if they don't, they may deal with some serious consequences, including denials of coverage. Their doctors may not be in network if they're in a Medicare Advantage plan that doesn't work for them, or their medications may not be covered if they're in a Part D prescription drug plan that no longer covers their medications. So Medicare beneficiaries should review the information that their Medicare plans send them this fall. So during this time, Medicare Advantage plans or Part D prescription drug plans should be sending the documents listed here: evidence of coverage, the EOC, and the annual notice of change, the ANOC. The annual notice of change provides consumers who are enrolled in these plans with information about how the plan is going to change in the coming year. The evidence of coverage provides a summary and an overview of the benefits that the plan is offering in the coming year. Both documents are very important for consumers to ask for and request to their plans, because this information is essential for them to make informed decisions about whether or not they should get out of the plan and choose better coverage. So if their existing plan coverage is changing, beneficiaries again should find out if their plan will continue to work for them in the next year. And that's part of the work that the SHIP counselors are going to be doing during this time of the year. We're going to be providing comprehensive counseling to Medicare beneficiaries who need assistance with evaluating their coverage. Part of that is using the Medicare.gov Plan Finder tool to do plan comparisons and help people find coverage within their zip code area. The last bullet point here is very important to emphasize, because many people don't know where they can get help. And so they don't know that we provide free assistance through the New Mexico SHIP program, through the state of New Mexico, through the Aging and Long-Term Services Department. And so the number where people can reach us is the number listed here at 1-800-432-2080. And this is the number to the Aging and Disability Resource Center, which is the point of contact for Medicare beneficiaries who need assistance to the state. Okay, so in this slide, there's two takeaway points in terms of the open enrollment period and Medicare Advantage plans, and what consumers, Medicare beneficiaries, should consider when they're evaluating their coverage and when they're considering enrolling in a new Medicare Advantage plan. So the first is, people really should be asking, are their current providers, their doctors, in the Medicare Advantage plans network? So the Medicare Advantage plan that is the best choice for the individual is going to be the plan that includes all or most of the providers that the person wants to keep in the following year. So if the person chooses a plan that does not include all of their providers as in network, they may have to pay more money, or worse, the plan may just deny coverage for that provider visit, and the person may have to pay more money out of pocket. So it is important for people to really choose wisely when they're considering all of the different choices and options when it comes to these Medicare Advantage plan products. The second very important criteria for Medicare Advantage plans is, does the Medicare Advantage plan include the list of covered drugs? So again, this is extremely important for Medicare beneficiaries who may be taking prescription medications. And if they're taking multiple prescription medications, it can be a challenge to find a Medicare Advantage plan that includes all of their medications on the plan's list of covered drugs, also known as the formulary. So if some of the medications are not included in the plan's list of covered drugs, the person may be stuck with denials of coverage for those medications, and again, may end up having to pay more money for their medically necessary prescriptions. So it is very important, and this is part of the work that the SHIP counselor does is to inform people of this important criteria that they really need to consider before they make a decision during the open enrollment period. So when considering Part D prescription drug plans, standalone Part D prescription drug plans, which means they're only the Part D component, they only cover prescription drugs. So there's one key question that Medicare beneficiaries should be asking when they're considering different Part D prescription drug plans. And that is, are their medications covered by the standalone Part D drug plan on the plan's list of covered drugs, also known as the formulary? So this is extremely important, again, for people who take multiple medications. They should be sure that their new Medicare Part D prescription drug plan includes all their medications on the list of covered drugs with the least amount of restrictions. So it is important to note, if some of the drugs are not included in the plan's list of covered drugs, similar to what I was just speaking about before in the previous slide, the person may be stuck with denials of coverage and end up paying more for their medically necessary prescription drugs. In addition, it is also important to note, Part D drug plans use utilization management restrictions to control the way beneficiaries can receive their medications. These restrictions include, for example, step therapy, which means the drug plan can impose a rule that the person has to use a generic, cheaper version rather than the brand name drug that the provider may have prescribed, for example. Regardless if a person has, for example, some people may not be able to take a generic, but if they're in a plan that imposes step therapy, the person may have to fight in an appeal so that they can have access to the brand name drug that their provider recommended. Prior authorization is another utilization management restriction. Prior authorization is essentially the plan, the plan rule stating that the person has to receive authorization before they are allowed to purchase or before the plan can cover the prescribed medication. So the last restriction that's listed here is quantity limits, and that's essentially when a Part D prescription drug plan may impose, for example, a limited number, a quantity number that the Medicare beneficiary can utilize every month, and that's regardless of what the doctor recommended. So for example, if you have someone who needs to take 90 pills in 1 month for a specific medication, prescription medication, because that's what their doctor recommended, if a person is in a plan that imposes a quantity limit of 30 for the month, then the person is most likely going to have to fight the plan in a written appeal with the doctor's support. So the recommendation here is it's important for people to try to avoid Part D prescription drug plans that impose these types of barriers and restrictions to their medication lists. So it's important that people find the right drug plan that includes the majority, if not all, of their medications on the list of covered drugs for the plan with the least amount of restrictions, with the least utilization management restrictions. And again, this is what the SHIP counselor is essentially going to be providing during open enrollment, during appointments with consumers who would like that type of assistance. In this slide, I do want to provide an outline of the Aging and Disability Resource Center and SHIP Medicare Open Enrollment Remote Counseling Plan this year. So due to the current public health emergency, and given that we service vulnerable communities, because we service, again, folks who may be living with a disability, who are high needs. So it is important that we protect the community as much as we can, and that we continue to provide services in the safest way that we can. So the SHIP team is planning to serve the public remotely to ensure the safety of the public and staff. In order to do this effectively, we are creating an appointment system where the public can sign up to speak with an experienced SHIP counselor. A very important component in this plan is the participation of pre-counseling volunteers. This is a role we created to assist us with the consumer intake process and the consumer appointment scheduling. With the help of pre-counseling volunteers, experienced SHIP counselors will be able to effectively complete plan finder comparisons and provide consumers with other open enrollment counseling. To ensure that the New Mexico SHIP program has the capacity to serve the public safely during the 2020 fall open enrollment period, again, we created the pre-counseling volunteer role that will function in an essential and supportive administrative capacity. Pre-counseling volunteers will be essential in collecting the necessary information that SHIP counselors will need to effectively complete Medicare fall open enrollment related appointments in a timely manner. So all of the tasks that pre-counseling volunteers will be asked to do will be, there will be training and supervision support. So pre-counseling volunteers will definitely go through step-by-step training in terms of how to use the public calendar to schedule appointments, and also how to utilize the electronic intake form that I will be discussing in the subsequent slides. So in this slide, I provide a summary of what the pre-counseling volunteer role entails. So first, when we speak about providing administrative support to the SHIP team, we mean things like retrieving phone messages left by consumers in a designated SHIP line or phone queue. And these are consumers that may be calling, for example, where they are requesting assistance during this open enrollment period to compare their Medicare coverage. And so those are the types of callbacks that pre-counseling volunteers will be assigned to do. And again, they will have an electronic intake form complete with a script where they can begin to make those phone calls and collect the important information. The second piece to that is engaging with consumers, and that's what I was leading into. So engaging with consumers interested in scheduling Medicare fall open enrollment counseling by taking live calls or doing callbacks. So again, we have designed a script to help explain the ADRC SHIP fall open enrollment appointment process. We have also created an electronic intake form to collect consumer information, including names, addresses, emails, the list of prescription medications. So basic information that we need, that our SHIP counselors need to provide more high-level, in-depth Medicare open enrollment counseling. The use of the electronic intake form, as I mentioned, to screen consumers for cost-saving benefits, including the Medicare savings programs and the federal extra help program. So no additional information is necessary about these benefits in order for pre-counselors to screen for them, because we have created an electronic intake form that provides probing questions and provides prompts that will help pre-counselors get at the information the best way they can by screening for these benefits. And it's essentially data collection. So it's asking probing questions to retrieve the information that we need as staff members to provide consumers with additional support and assistance about cost-saving benefits that can help save them money and help them, remain sustainable when it comes to their Medicare costs. The last piece to that would be also pre-counselors will be trained to add consumers to a separate ADRC callback list if the consumer wishes to discuss matters not related to the open enrollment period. So for example, some people may leave messages with their name and number, but they may want other types of services and resources not fall open enrollment related. So a person, for example, may want information about Medicaid, the state Medicaid program, a Medicaid waiver, or other things unrelated to open enrollment. In that case, there will be a process and a protocol that pre-counselors will be trained to utilize, including a callback list for the Aging and Disability Resource Center staff. The callback list will be sent to the supervisor, who will then be responsible for delegating those callbacks to staff members so that we can proceed and assist with these other issues that people may be calling about. In this slide, I really wanted to show what the intake form will look like. And so we're planning on using a SurveyMonkey for this electronic intake process. So the idea is that the final intake form will be an electronic form, again, via SurveyMonkey. And we will provide a PDF copy of the form so pre-counseling volunteers can become familiar with the prompts and the directions. And you will note that the intake form provides directions and guiding scripts. We do not just jump into the rote data collection here. The idea is to try to establish trust with the caller in order to collect other important pieces of information later. So you can see here on this slide, we begin with, hello, my name is Samantha, and I am calling from the New Mexico Aging and Long-Term Services Department. I am calling because Mr. Smith left a message regarding requesting assistance on the State Health Insurance Assistance Program, or the SHIP Medicare Fall Open Enrollment phone line. Is Mr. Smith available? And then the prompt would proceed. If yes, and the person is available, we would say, I am calling to provide you with information about how the New Mexico SHIP office can assist you. First, I would like to confirm, were you calling about the Medicare Fall Open Enrollment period? If the person says yes, then we would proceed. If the person says no, then we would probe a little bit more. Well, why were you calling? And then if the person is calling about another issue, there will be a process, and the pre-counselor will have a list where they can add the consumer for a callback from the ADRC. In this slide, I wanted to present the demographic information that we need. So this is all very basic information. So we're asking for last name, first name, the zip code, the county, the preferred telephone number, whether or not that phone number is a cell number. So it is important to note that it is very important to attempt to collect the beneficiary's email or the caregiver's email, as we would like to send as much information to the person via email. The information we would like to send via email is not client sensitive. SHIP counselors would send the plan comparisons and a plan finder appointment letter reminding the consumer of what they need to prepare for the appointment. So again, the email is going to be very important. And some of those other questions, asking the person if they wouldn't mind to receive, for example, text messages related to the Aging and Long-Term Services Department activities and services. That would allow us to provide even a text message appointment reminder after the pre-counselor volunteer has been, was able to schedule an appointment. We would be able to send those messages. The preferred email, again, I cannot overstate how important the email is going to be for us, so that we can send consumers timely information so that they have it right away. So this slide is going to be a little hard to see. So this shows the health insurance information that we will need for the plan finder appointment. So you will note the intake form includes many probing questions here and guidance for pre-counselors. So for example, at the top, we begin with a script. To better understand your health insurance coverage, we would like to know what kind of Medicare coverage you have. when you go see a new doctor, what health insurance card or cards do you provide? So there's a probing tip for the pre-counselor here. Ask the person to read the name from their health insurance cards or card. So choose one of the options below. Now, it is important to note that we really, we're going to try to do our best to collect as much accurate information as the Medicare beneficiary is willing to give us. But we realize some people may be really confused about their coverage and they may not be able to access, their health insurance cards when you call, or they may not be able to provide you with that type of detailed information that we're looking for. And that is okay. We can continue with the next questions. We really don't want people to get stuck on one section and not move on. So if you've done your best as a pre-counselor, you've used the probing tip, asking the person to read the name off of their health insurance card, and still no luck, it's okay to move on, right? So that's going to be important as well. There will be a choice in the electronic intake form that will say, the person does not know, so that we can move on to the next piece. But we really want to emphasize the importance of trying to collect as much information as possible so that our SHIP counselors will have as much information that they need to provide the best counseling that we can to the Medicare beneficiary. In our experience, again, many Medicare beneficiaries do not know what kind of coverage they have. So again, the probing questions are meant to help you, to help the pre-counselors tease out the information. So as many of you know, when people call the Aging and Disability Resource Center, they receive holistic counseling. And what that means is they really receive not only a response to the question that they're asking about, but they receive more information about programs that can help them. So we at the Aging and Disability Resource Center, or the ADRC, help people connect the dots so that they can remain independent and sustainable when it comes to their healthcare costs. So in a similar way, we really want to incorporate benefit screening and provide callers with information they did not know they needed. The probing questions in this section of the benefit screening section of the intake form are meant to help pre-counseling volunteers tease out whether the person receives assistance with covering their Medicare costs, such as the Medicare savings programs, for example, or the federal extra help program. We definitely do not expect pre-counselors to know the ins and outs of these very important benefits, such as the Medicare savings programs and extra help. And again, we provide probing questions that will provide SHIP counselors and staff members with the data that they need to make informed decisions about whether or not the Medicare beneficiary that we're assisting may have these programs and how we can best assist them. So again, the probing questions and following those prompts in the intake form are going to be really important for the pre-counseling volunteer. For people who may be eligible according to the information that pre-counseling volunteers gather in this section, there will be a separate list for benefits assistance. And you would just ask the person if the person would want to call back regarding benefits assistance later, where they would receive a call back from a staff member who would provide assistance with some of these benefits that the person may be eligible for according to the responses that they provided. This is the last section of the intake form, and I really want to emphasize the importance of this last section for our SHIP counselors. This is the section where pre-counselors are tasked with collecting the person's medication list and the person's pharmacy. So accuracy here is very important in this section, especially when it comes to the spelling of the medication names and the pharmacy location. So you can see we start, or it's very hard to see, but at the top we begin with a script. So now I would like to ask you about your medication list. Do you have your medications in front of you? If not, I can wait a few minutes while you access all the medications that you take, as I will need to ask you to verify the spelling of each medication that you take. So it's pausing for a moment and asking the person to, do you have your medications in front of you? Because if you don't, I can hold for a couple of minutes while you gather your medications, no problem. It's just very important for us that we get your medications right, because we want to make sure that we provide you with the best possible service and that we can provide you with the best plan comparison for your appointment. So that's the type of messaging that is going to be weaved and it's embedded within the electronic intake form. So again, it's really about, trying our best to collect as much information that we can that the person is able and willing to provide. In this last slide, I really would like to go over some expectations that we have for pre-counseling volunteers. So again, to ensure that the SHIP team is organized to best serve the public during open enrollment, we do have a few expectations for people interested in volunteering this fall. So since we will be working with some consumer personal information, we will need everyone to sign a confidentiality agreement online. We are working on getting this done via SurveyMonkey. So we actually already have the link to the confidentiality agreement, and I will be sending that out to folks who have expressed interest in continuing with the pre-counseling volunteer role. In terms of shifts, what do we mean by shifts? So since this volunteer role requires some training, we want to make sure that we have a stable and committed group. So we are more than willing to work with your schedule. We need folks who are willing to be consistent with a day and time when they are best available to contribute and assist. So if you can't commit, then this may not be a good volunteer opportunity. And again, when in saying that, what I do want to emphasize is that we work with a volunteer model. So we definitely understand and appreciate all of our volunteers. And we realize that people have lives and there may be appointments that come up. There may be doctor's appointments or other things that may come up where when our volunteers simply cannot attend their shift. And that is okay. We definitely understand that. What we do ask is for folks to communicate with us whenever they can, to let us know either ahead of time or whenever they, it's possible to let us know that they will not be able to attend their shift. But what we really are emphasizing here is what we don't want is just folks disappearing where we don't hear from them. Because again, we are trying to do our best to provide as much training as we can to prepare folks for the pre-counseling volunteer role. And what do we mean about requesting volunteers to commit through the open enrollment period? So for the same reasons that I've already stated, we really need folks who are committed to one day and one shift and be available through the Medicare fall open enrollment season. Our team does not have, again, the time to train new people through the season as we serve the public. With that said, again, we realize that things come up and that people have lives, as I mentioned. So for this reason, we really, we request that volunteers who can't make the regular shifts communicate timely with their supervisors. If you can't make a shift, just let us know, and that's definitely okay. We just want to avoid recruiting folks who will completely, again, drop off and disappear during the season. So in a live training, you would have the opportunity to ask me questions. Since this is not a live training, I do want to welcome you to reach out to me via phone or via email to let me know if you have any questions about the role, if you have any questions about what I've discussed today. The next steps is I will be sending an email along with the confidentiality agreement and a SurveyMonkey needs assessment, a survey, essentially trying to understand kind of what people, for those of you who are interested in the volunteer, the pre-counseling volunteer role, we want to know, for example, what tools you have accessible to you. So for example, do you have a computer or do you have internet at home? So those are some of the things that we ask in the survey that we send out. And so we really appreciate all of the time and the energy and your willingness to kind of proceed with the pre-counseling volunteer role. And again, I welcome any of your questions, and I really thank you for spending this time during this training.